We may say this is a post-pandemic world, but the pandemic has not really left us. There are new variants, there are sublineages that are emerging every day, but despite that, people are moving forward. But we must be careful as well. And this is an infectious disease which perhaps could stay across the world for a longer period of time than we actually expect it to. But what is the future of infectious diseases such as this with origins in zoonotics, and especially if we talk about COVID-19? I have with me Dr. Amita Gupta, who is the co-chair of the Gupta-Kilinsky India Institute as well as the chief of Division of Infectious Diseases at the Johns Hopkins University. Ma'am, thank you so much for joining me on India Today. So first of all, we're here despite the fact that there's the pandemic that's still going on in many countries. We're looking at lockdowns in China at the moment as well. India's fairly comfortable at this moment, but how long would it stay like that?
Great question. If I had the answers to all of these, I could be very, very successful and wealthy. No, listen, I think that we have to be prepared for cycles of this virus, and it's unclear if this will be where we see lots of high peaks and times of no peaks, or if it'll essentially transition to where it will be a disease that will either be seasonal or even like the flu, where we might see it, mild some years and then worse, but seasonal. And so I think we have to be prepared for it not going away. It is a virus that is in the environment. It is transmissible. It is able to mutate. And we have, with vaccination, done a fantastic job of reducing severity of illness. And that's the goal of vaccination, so that we can live with the virus. We'll have our new normal. And when there's periods of a lot of infection, we'll go back to masking and being more careful. And when there's safe times, we can sort of be at places like this when the counts are low.
Very important that you mentioned that, because many states across India at the moment are also going forward with no masking. States like Maharashtra, Delhi as well have made it non-essential to now mask in public places as well as indoor. What is your assessment as Chief of Infectious Diseases at Johns Hopkins for India as a country on the whole? Because we've seen 3 waves. And we're sort of expecting the 4th wave. We don't know for certain when it will hit India, because we've seen an outbreak of Omicron as well. People have had exposures here. What is your analysis, ma'am?
Yeah, I think we have to be prepared for future outbreaks. And as I said, how tall the peak or how small the peak will all depend on the variant, our host immunity. The hope is that the vaccination, which induces what we call T cell, which is cellular mediated immunity, as well as antibody mediated immunity, is enough to prevent serious illness from even new variants. And that's the goal, and I think that we're sort of trying to figure out what's the right combination of how many boosters, how long is the immunity, and so we need good science, we need good data, and we follow the data and the science as we learn as we go. Yeah.
With the boosters, in India, we've not yet begun giving boosters to those below the age of 60 years. How important it is to give that 3rd precautionary dose is what we're calling in India at this moment when we're looking at ebbing of the COVID wave as such.
Yeah. Well, I think we have still room to go to increase vaccination. I mean, India's done an amazing job compared to, it's scaled up from last year was 2% when the Delta wave hit. We're now over to 60+%, with 2 doses and 70% with at least 1 dose. Amazing vaccination campaign with the size of the country. But we're not at 90%, right? And we also don't know quite how long the 2-dose Covishield immunity lasts. And essentially, it's how long will it last? What are the new variants? How well does it function against emerging variants? But I think we need the messages, continue to vaccinate and continue to invest in the science and epidemiology so we collect data and know how best to move forward. In terms of the booster, I think that, I think the government has really got a great handle on, the policy of when is booster needed. in the United States, we're now using the mRNA booster for more elderly people older than 50 because there's some data to suggest that there may be additional benefit. There was recent data from Israel that showed that, the fourth booster, when it's given, it basically, prevents infection for a very short amount of time. So there are two things to think about: how you get the infection, and then once you have it, what happens in terms of progression, right? And the goal of vaccination is preventing the severe, progressing to severe disease. And vaccines that way is the key. And so most of the vaccines we're using in the world that are, heavily available are doing that. It's just we may need to tweak the vaccine to the new variants a little further.
Yes.
Yeah.
Yes.
Yeah.
So which means that, India should perhaps begin to give the boosters now because data and science supports it across the world as well?
Well, I think there is likely to be some area of use of booster, but I think that I would defer to my colleagues here who really have the science and the data of what specifically is relevant to the Indian population with the Covishield and Covax and other vaccines that have been used here in the population.
And, you also mentioned about Covaxin. Recently, we've seen WHO has suspended its supplies across UN agencies. But the vaccine seems to be safe. There aren't any concerns related to the safety of the vaccine. Would this impact, demand of Covaxin outside of the country as well? I know that Ocugen in the United States is working with Bharat Biotech to bring that vaccine, the whole Viron vaccine for Americans in the U.S.
Yeah, I think that out of abundance of caution and the sort of good manufacturing practices is what was the basis of it, and so I don't have the details, and I know that Bharat Biotech, a very reputable company, is working hard to sort of address any findings that were brought on by the WHO's evaluation. It has, it's a robust vaccine that's been developed, and so I think let's see what the outcome of the further evaluation is, and I have full confidence that the company and the WHO will guide the appropriate use of the vaccine, and and I think we'll find out more as information comes up.
There's a huge anti-vaccination campaign that goes on in many countries outside of India. Compared to that, India has been more compliant when it comes to, knowing that one must get vaccinated. Do you think that it's justified to, look at these campaigns at a time when we have lost many lives across the world because of COVID?
Yeah, it's amazing. Even when you have vaccines and you have them available and you have them low cost, we have to remember human behavior and psychology and communication. And unfortunately, in places like the United States, where we have a substantial population who is vaccine hesitant, and so it's heartening to see that that's less of an issue, but it's not zero here. And as you said, all throughout the world, we have to do a good job of educating, communicating, and these are vaccines that are based on decades of science. And now we have a lot more literally billions of people have been vaccinated. So we have a lot of robust data to know their safety. They're really very safe vaccines when you think about how many people have been vaccinated and we've protected lives and prevented severe illness.
And as we talk about vaccination, we also talk about new variants and subvariants and lineages. So XE is the new buzz, and it happens to be a recombinant of Omicron. Could you simply explain the difference to our viewers? What exactly is XE? Could it pose problems for us? Because UK has recorded more than 600 cases of this particular recombinant variant from Omicron.
Yeah. Well, I know it's thought to be a recombinant from the Omicron as well as the BA2, the more recent, more transmissible variant, and so I think it's early days. We still need to understand the full clinical sequelae, how it presents, and what's the risk of progression. There's some data to suggest that it's 10% more transmissible, but exactly whether it leads to more severe illness is unclear. And so we just don't have enough data yet to fully understand its implications. But this is a virus that, as it mutates. It's a coronavirus. We know that it's now present in the world throughout, and it has lots of opportunity to evolve.
When you talk about tweaking vaccines as well, is it easier to tweak vaccines that are mRNA based than tweaking vaccines that are non-mRNA based vaccines? Is that the science?
Well, I think that, we have now lots of different kinds of vaccines, and the mRNA platform does allow for more rapid reconfiguration when you have emerging variants, but it still takes time. So I think that the goal is to really develop vaccines that are what we call pan-coronavirus, which can protect a variety of the stable parts of the virus. If we can sort of study what are not mutating but still elicit an immune response, then we can sort of have faith that the parts of our immune system are going to react to the right parts of the virus, no matter whether it's mutated or not. So we're looking at some interesting nanotechnology approaches that are being used to develop these pan-coronaviruses, and there have been some recent phase 1 trials that have been initiated because there was some promising data from animal studies.
And is Johns Hopkins involved in this particular research and study as well?
So we we certainly are contributing to some of the immunology and science, absolutely, and we are enrolling patients into trials to look at new vaccines, for sure.
So, ma'am, does this mean that there is no end game for the coronavirus? Is it at all an endemic? And how much time will we take to reach that endemic stage where it actually becomes like, I don't want to say common flu, but I want to say a virus that will not kill you. Yeah. So how long will we need or will we have in the future to see coronavirus become an endemic?
Yeah, well, I think I don't have the exact answer for that. I wish I did. But I will say that we can see that with each subsequent wave, at least the most recent one, even though it was more transmissible because more population was vaccinated and because, we probably also have people who have natural immunity, that there's been less severe illness and hospitalization and death. So that's the goal with vaccination and ensuring just a larger population is protected from severe illness. Or death. And that's so exactly how long we will have to see when it becomes either not around or minimally impacting our life, I couldn't tell you. I wish I could.
And my final question to you. Children in India have not been substantially vaccinated. We've still not opened vaccinations for below 12 years. Mm-hmm. How important is that? Because children are getting vaccinated in the US, in France, Germany, other countries. But experts here suggest that because children can handle COVID well or they don't get as severely infected, they do not require a vaccine. Do you agree with that?
Well, I think that for vaccinating children, we know that young age, you have much less illness, right? And as I said to you, the goal of vaccination is to prevent severe illness. And so that's why we prioritize older age groups, because they are the more likely to develop severe illness. So I think that we're working on globally identifying the right dose and the right vaccine for children. And so it will certainly come to pass where we will see children get vaccinated. We just, because they have mild to no illness, it's been less of the population that we've prioritized.
So should India look at changing its policy right now, at least for the third dose booster and children both?
I think right now the priority is to continue to vaccinate the older populations and to get enough science and data to ensure that whatever we do safely, and that children, there are vaccines. We're figuring out the mRNA vaccine doses for young children. We're doing the same with the Covishield and other vaccines. So stay tuned.
Well, that's a lot of information, but thank you so much for speaking with me. And science and data will continue to support and back emergence of new variants, and if we'll have another variant will be known. But at the moment, at least XC is not looking to cause that much of a problem. But vaccination seems to be the key to at least bringing the pandemic to an endemic stage. We, and as well as Dr. Amita Gupta, we aren't certain when the pandemic will end, but there will be answers in the science and data that will come through as well from across the world on coronavirus. With Abhishek Singh in New Delhi, Milan Sharma for India Today.